Hey, my name is Mason Carter. I am a registered nurse working at St. Luke's Boise Medical Center in the Surgical Intensive Care Unit. Currently, I'm working on attaining my Master of Science in Nursing through Northwest Nazarene University. I'm training to become a family nurse practitioner. I'm really excited to provide care at an even higher level by becoming a mid-level provider. Since providing a higher level of care requires a more in-depth knowledge of nurse theory, I am pleased to have had the opportunity to study the life and work of Myra Levine, which will provide any new advanced practice provider with an effective model in creating great relationships with clients that can result in much better patient outcomes. So let's talk about Myra Levine by first addressing her personal life. She was born in Chicago in 1920, where she grew up with two younger siblings, both a younger brother and a younger sister. She was initially interested in pursuing a career in nursing because of her father's poor health. Now, there's limited information regarding what his exact health struggles were. However, it has been said that she was inspired by the nurses who took care of him. She really valued education and became well educated in the nursing field. She received her nursing degree from Cook County School of Nursing in 1944. Later, she earned her Bachelor of Science in Nursing from the University of Chicago in 1949. And finally, she received her Master of Science in Nursing from Wayne University in 1962. With a strong educational background, she enjoyed a very respectable career in both the clinical setting and in nursing education. So first she began her career as a private duty nurse and then a civilian nurse with the U.S. Army. These positions provided her with the experience needed to become a leader in the nursing field, as she then became the director of Drexel Home for Older Adults in Chicago. She then took her career to the operating room, where she worked as a surgical supervisor at the University of Chicago, and then the Henry Ford Hospital in Detroit. Academic roles she held for teaching included teaching positions at Cook County School of Nursing, where she first graduated nursing school, interestingly, Loyola University, Rush University, and the University of Illinois. She had the unique experience of being a visiting professor at two schools in nursing in Israel, those both being Ben Gurion University of the Negev and Tel Aviv University. Those who knew her best say that she really treasured the experiences she had working in Israel, and that the professional relationships made there helped her become more conscious of her spiritual heritage. Awards and recognitions. As she worked hard in her nursing endeavors, she was recognized for several prestigious awards that I want to mention here. Most recently, in 1992, she received the honorary doctorate from Loyola University in Chicago. In 1990, she was recognized for her exceptional contribution to nursing with the Alpha Lambda chapter of Sigma Theta Tau. And with her pursuits to improve mental health in Israel, she was made an honorary member of the American Mental Health Aid to Israel in 1976. She was also the first person to receive the Sigma Theta Tau Elizabeth Russell Belford Excellence in Teaching Award in 1977. Now, all throughout her career, she was an active member of the Illinois Nurses Association as well as the American Nurses Association. In 1987, she retired, yet she still remained very committed to the development of nursing theory. She died in 1996, and she'll always be remembered as a devoted wife, mother, nurse, innovator of education, and a very dynamic public speaker. Now let's look at the philosophical underpinnings of her theory. As the director of Drexel Home for Older Adults, she had the opportunity to develop a course for registered nurses. And it has been said that this is where her love and passion for nursing and nurse education was born. Also, one of the most profound experiences in her life that led to her passion for compassion was the death of her firstborn son, Benjamin. He died when he was just 3 days old, and after his death, she had an increased desire to help comfort those who passed through similar hard things. She magnified this life calling by giving comfort to those mothers at the Henry Ford Hospital in Detroit when she was appointed the surgical supervisor there. She wanted these mothers to know that they were not alone. And she writes about her experience of losing Benjamin and how she felt so abandoned by the nurses who held stewardship over her at the time of his passing. And so she promised herself that she would not let this happen to others, and she became very passionate about the holistic approach of caring. And so these were kind of the things that led to the theory that she would develop later in life. Let's look at the main concepts of the model. Her special interest in providing care while maintaining the unique wholeness of the individual was made manifest when she developed a new curriculum at the Cook County School of Nursing. And this new curriculum focused less on the procedural and disease-oriented way of providing care, which was traditionally the standard of practice care at the time. This gave way to the birth of her famous conservation of principles model, which emphasized the maintenance of wholeness through conservation of energy, structural integrity, personal integrity, and social integrity. In her writings, she defines the word conservation as, quote, keeping together, end quote, the wholeness of the whole person. And we'll go through each of those parts of the conservation model later in this presentation. As one of the few nurses to cite scripture, she used the Old Testament to support her beliefs about the sacredness of human life. Her writings often cited Genesis 1:27, which states, "And God created man in his own image. In the image of God created he him. Male and female created he them." So different from other nurse theorists of old and modern times even, she viewed spirituality as one of the dimensions of the whole person, which actually integrates and interacts with other dimensions of life. Now let's take a closer look of the major components of this theory and model. In order to emphasize the importance of holistic care, Levine used Bates' classification of the external environment within her theories, which include the perceptual level, operational level, and conceptual level. So the perceptual level includes how individuals respond to the environment with the senses, including sight, hearing, touch, taste, and smell. The operational level deals with the aspects of the environment that are not seen but affect the individual, including things like radiation, microorganisms, and pollutants. And finally, the conceptual level. This includes things like language, religion, values, and beliefs of individuals. Also, Levine uses the three characteristics of adaptation involving historicity, specificity, and redundancy. Historicity refers to the adaptive responses that are influenced based upon generations of genes and personal life experience. Specificity refers to the different responses elicited within the human body. For example, touching a hot stove results in a quick withdrawal from the heat, and then the inflammatory response at the burn site is a different response. Redundancy, this revolves around the idea that some systems may become redundant and may respond to corrective action temporarily. Now that sounds really complicated, but she oftentimes used the example of getting allergy injections to stop the effects of severe allergies. Now let's take an even closer look at the major components of the theory and model. Levine explains that the outcome of adaptation is conservation. She states that the word conservation in Latin literally means to keep together, like I mentioned before. She describes individuals as being in a state of conservation when they effectively adapt to change. She believed that the nurse plays a key role in relation to conservation for the patient by focusing on the four conservation principles of nursing mentioned before. These being conservation of energy, structural integrity, personal integrity, and social integrity. So let's take a look at the conservation of energy. Now this is based on the idea that a person requires balanced energy in order to carry out the requirements required of him or her throughout the day. She believed that energy levels can be measured by how tired a person is or how much fatigue a person has. She described that the fuel for energy is food and oxygen, which are circulated in the bloodstream. Levine taught that the disease process increases. She taught that the disease process increases the demand for energy. So when a person is sick, oftentimes that will require more energy to be elicited. She claimed that for every degree Fahrenheit increase in body temperature, there is a 7% increase in metabolism requirements. She believed that conserving energy meant to encourage the patient to do activities which did not result in excessive fatigue. However, this did not mean eliminating all activities that require energy. Just those, she just encouraged patients to be involved in activities which did not result in excessive fatigue. Now let's look at the conservation of structural integrity, the second point of the model. This concept is pretty straightforward as it involves maintaining the structure of the body by preventing injury, promoting healing, and restoring function. She often would give examples like the inflammatory immune response and the reflex to quickly withdraw to a painful stimuli. She often taught that sometimes individuals require surgery in order for structural integrity to be restored or redesigned. Some examples she used include the formation of a stoma or even the amputation of a limb. Now, personal integrity. This concept deals with the fundamentals of self-identity and self-worth. She claimed that every being needs to have a sense of identity and self-worth. She stressed the idea that the mind, soul, and emotions are all interconnected together with the entire body. With patients coming from all different lifestyles and backgrounds, Levine taught that it is important for nurses to be respectful of all preferences and beliefs in order to maintain the self-worth of the patients they care for. And finally, social integrity, conservation of social integrity. This is the concept Levine uses to stress the importance of human interaction and how strong relationships can help in times of illness or anxiety. She believed that social work was an important key in helping people receive their basic needs in times of trial. Now, I'd just like to go over this chart that kind of reviews the basics of her model, the conservation model. And you'll see the 4 different parts of the model: the conservation of energy, structural integrity, personal integrity, and social integrity in the middle. And you can approach failure to conserve these energies results at the top in an imbalance in the client's wholeness, while as you conserve these energies, that results in the wholeness of the client. And so you'll see that an example of conserving energy is activity rest balance, proper sleep pattern. All these things will result in the conservation of energy, which will result in the wholeness of the client. Whereas opposite of this, overwork, lack of sleep, overexertion will all result in failure to conserve this type of energy and conservation, and will result in the imbalance in the client's wholeness. And so this is just a visual that you can see as you strive to conserve energy, structural integrity, personal integrity, and social integrity. Results will be that the client will become more whole and heal faster and have much better outcomes overall. So now let's talk about how this relates to my desired practice in application to the real world. Family practice is my chosen area of practice. I enjoy being in the clinic and having the opportunity to see a wide variety of things and issues. I find it very satisfying to be able to help someone with a need or concern they might have in a really timely and very personal way right there in the room with them. This is really different from my background as an intensive care nurse. And I guess having seen the worst case scenarios of poorly managed health, I love promoting wellness before disease and disability strike. And I guess I found that the work developed by Myra Levine can be effective with any unique patient encounter that might present in my future career in family practice. I've actually found a few examples of recent studies in which the conservations of principles model were applied and in the family practice setting. The first is I found a recent article regarding how primary care providers can enhance their ability to provide collaborative care with struggling veterans suffering from post-traumatic stress disorder. This study used the conservation model in order to focus on adaptation while also maintaining wholeness and using the model, the conservation model. Research has revealed that this model strengthens communication, improves delivery of care, and increases mutual understanding. And these are all important when caring for a veteran struggling. With the model being applied, the primary care provider is seen as part of the soldier's environment that offers skills, knowledge, and compassion. And every soldier is seen as an individual with unique needs. And therefore, treatments for each individual vary depending on the provider will realize that treatments will vary depending on exposure to trauma, traumatic brain injury, and/or poor social support, depending on the needs of the individual. After identifying specific needs, the model encourages the development of a personal relationship between the provider and the patient, allowing them to identify concerns and work together to find solutions. And so the study goes on to find things that were most beneficial to patients struggling with PTSD. Some ideas included therapy animals, therapy dogs, things like that. But the thing that I thought was most interesting about this study is how the primary care provider was able to really connect at a deeper level with the patient using the model, the conservation model by Myra Levine. The second example I found is how the conservation can also be applied to patients who have undergone injury that may require orthopedic surgery. In this article, it states that the model specifically speaks for interactions that the model specifically speaks for interactions that are intended to promote adaptation and maintain wholeness. So the ability to adapt is described within Levine's model as the organismic response, which provides an individual with the perceptual awareness needed to gather and maintain safety. So patients undergoing injury and orthopedic surgery have the opportunity to complete the healing process and become whole through the conservation of integrity, like we talked about before. Providers can assist the patient in helping them learn and develop adaptation techniques as they prepare for and heal from surgery. This preparation will allow for the conservation of energy and personal integrity, making the entire process a much better experience for the patient. Levine's model is consistent with the latest, we found consistent with the latest evidence-based research in that treatment and recovery of orthopedic injuries involves the collaborative partnerships between the patient and the provider, which results in faster healing and even better pain control. And the third one I wanted to discuss was a diabetes case. A recent article describes how primary care providers can benefit from the conservation model when caring for patients specifically with diabetes mellitus type 2. Now, in this research study, the model was used to help patients with diabetes adapt as much as possible in order to achieve the highest quality of life. It focused on the concept that holism results as different functions and parts of the body interact and respond to the surrounding environment. With a quality relationship between the client and nurse, both the client and nurse were able to identify outside influences that may be affecting management of the disease. For example, income level, habits, family life, and so forth. The model led to optimal diabetes management with interventions that maintained energy conservation and personal integrity as the nurse sought to understand where the patient was coming from and what changes would be possible in order to manage the disease more effectively. Overall, I really enjoyed the experience of studying the work of Myra Levine, and I've had the opportunity to really ponder and focus on how her model really is a great way to provide providers the ability to strengthen their relationship with patients, understand where they're coming from, and how different factors in the environment will affect their healing and recovery. I really admired her spirituality and the strength that she exhibited throughout her entire life as she was firm in her beliefs in trying to make the healing process an easier experience as patients may go through many hard times. And I hope to try to emulate that selfless and Christ-like way of providing care by following her model and doing the best that I can to be there and as a resource for my patients. So overall, I was really thankful for this opportunity to study Myra Levine and hope to apply the conservation model in my daily practice as a nurse practitioner in the future. And here's my works cited. Thanks, and have a great day.